So how many of you have ever heard of a patient support program before? A PSP? How many of you are a part of a patient support program? Okay. I think you might change your answer when you really know what that means. I think so. Okay, so a patient support program is a privately operated set of services that's designed to support a patient through a number of therapy-related needs. So you all just learned about my health background before lunch. Because I just started a new treatment on Tuesday, I'm actually now in my 4th PSP program. So I've been in a lot of PSP programs. Basically, every time my treatment changes, I get a new patient support program. So as I said, you might change your answer in a little bit once you learn more about it. So the oncology PSP is one component of the patient treatment journey. So for example, it's a one point of contact. It's a coordination between key groups of people. For example, your doctor, your nurse, your infusion clinic, the blood clinic, the pharmacy who sends your medications, et cetera, et cetera. It's simplified and compassionate. They also do patient status tracking. So for example, you heard me say that patients don't always do the best job at reporting outcomes. So not only are you reporting outcomes, not only should you report outcomes to your doctor, but you should also report outcomes to the patient support program. It's caring, supportive, and it's education. Reimbursement. Has anyone ever had help getting reimbursement for a medication or had to fill out forms to deal with reimbursement for medication or treatments? Anybody? Okay, so you likely done that. You did that in conjunction with a patient support program. So it's expertise in provincial coverage. We know here in Canada, healthcare is provincially. It's not the same everywhere, unfortunately. Some provinces are a bit better than others. Clinical pharmacist guidance, etc. For those of you who are visual people, here's a very simplified graphic, of patient support, the oncology patient journey. So for example, you have a patient, they're enrolled in a patient support program. They get usually a phone call or an in-person visit from the patient support program, a welcome. Then they you can talk about reimbursement or navigating just, submission of reimbursement and financial support and financial assistance. Then that's also coordinated with the pharmacy who may ship your specialty drug. So depending on the type of medication that you're on, your specialty treatment may come from a specialty pharmacy. Like mine comes from one, some you may have heard of, or like Innomar or, Bayshore. Do they have that in Alberta? I apologize if I'm Ontario focused right now. My apologies. Yes, so they also would patient support programs will also deal with public and private renewals, compliance and insights, and the last part is the reporting and analytics. That's that key part about us patients reporting our patient outcomes, so that data is there. All data is good data, right? To be able to see lots of, for example, the new treatment that I'm starting, once I get out of my infusions, I'm going to move to self-injection. They asked me if I wanted a syringe or if I wanted like an EpiPen, right? Like shoots, you push the button, it shoots in. The first question I asked was, have you had patient reported outcomes of the medication being painful? They told me yes. And I said, okay, in that case, I would like the syringe so I can push the medication in slower. So it's not as, for example. But thank you to all the patients before me who reported that outcome, or else they wouldn't have been able to answer my question. So the PSP program, patient support program, looks different in many different spaces. The 3 guests that we have here today, I'm actually in spirit of conversation. I hope it's okay, ladies. In spirit of conversation, I'm going to have you introduce yourselves, who you are, where you're from, what you do. I think that's better, especially to facilitate a discussion. So we have 3 guests here. They're going to introduce themselves. Then we're going to get into some questions about PSP, what can they do, for those of you who are in the room. Okay, so please join me in welcoming our guests to the stage. Okay, who would like to start by introducing themselves? You have the mic.
I have the mic, so apparently I have to go first.
Yes.
So good afternoon, everyone. My name is Shanta Zuroc, and I am the Director of Reimbursement for Innomar Strategies, which is one of the PSP companies here in Canada. My role is a little bit one of the sort of, I sit in a program agnostic, so I don't work for just one medication that we support. I work for all of them, and my area of expertise is reimbursement. So I am a clinical pharmacist by background, but I was just telling my colleague here that I probably wouldn't trust myself in a dispensary anymore. It's been a long time since I've been in there, but I do maintain my license, and I live here in Alberta.
Good afternoon, everybody. My name is Iris, and I am the pharmacy manager of Bioscript Pharmacy in Edmonton here. And so I am responsible for the operations of our pharmacy, where we are shipping out the medications to our patients, whether they're being infused or they're oral treatments or injections. And so I have a large team that I help facilitate to ensure that the patient experience is as simple as possible, particularly with specialty medications. Just like Shanta, I'm born and raised in Edmonton as well, and clinically as well. It's been a long time since I've also kind of worked in the dispensary as well. But pharmacy, I think collectively we have a passion in wanting to help patients.
So my name is Jana Gallagher, and I work for Jansen. So I'm a little bit different from these guys because I actually work for the manufacturer. And at Jansen, we have our own patient support program called BioAdvance. And so what I feel like I have the best job at our pharmaceutical company, but I get to design programs for patients. So that's, we have a new medication. It's designing what are the services and things like that that we can offer to our patients. So sometimes I think I've got the best job. I'm not from Edmonton. I'm a born and bred Newfie, but I do live in Ontario. The Newfies over here, yeah. Me and Chantel are buddies now.
I find them wherever I go.
We're everywhere.
I found Bev.
Oh, you're a Newfie too?
Yeah.
Oh, nice.
What a situation we've got ourselves in here. Okay, so the first question actually is going to be for you, Shanta, if that's okay. But granted, ladies, if you have anything to add, by all means, please add. It's a two-parter.
Oh, okay.
Sorry. I'm
That's
going to
okay.
read both.
I had the Diet Pepsi, so we're good.
Okay. I'll read both. If you need me to say it again when you get to that part, no problem. So the first question is, how can patients access their cancer medications in Alberta? How do they access them? And then the second part of that is, who is responsible for reimbursement and in what context? Because I have a feeling it could be different depending.
Okay. So it is a little bit, now
Okay, it's a lot, I know.
Okay, so we are quite lucky here in Alberta in that our, sorry, excuse me, if cancer drugs are on the formulary in Alberta, and formulary is just simply a list of drugs, at Cancer Care Alberta, then it is covered by the province. So all drugs for the treatment of cancer in Alberta are covered by our system, to put it simply, in Alberta. Now, the pathway for a medication to be covered and to be on that list is a little bit arduous, and it can take a significant amount of time, sometimes up to 2 years from when it's approved in Canada to getting onto the approved list at Cancer Care Alberta. So, but once it is on that list, everything is taken care of. That's a little bit different. So, Jana will say from Ontario, where they have a little bit of a different system. So we like to talk about cancer, and to put my Western hat on here. Manitoba West, we do it really, really well. Ontario East, they have some work to do.
Ontario's awful.
Right? It's awful. So in Ontario, it actually depends on what mode of administration. So if you are on an oral cancer drug, it goes through one system. If you're on an IV cancer drug, it goes through a different system. So we won't get into that because we are here in Alberta, so we're lucky that the covered medications. Now, if your medication is not yet on the list, then it's a patchwork. And it's a patchwork of coverage from, it could be from patient support organizations, patient advocacy organizations. They could have some funding available. There is compassionate funding from the drug programs at certain times. There is private coverage. If you have a retirement plan, and depending on what type of retirement plan you have, it might have a generous drug benefit, and it might not have one. So that's the overall simplified version of the landscape, and I've completely forgotten the second question.
No, I think you answered. It was
Did I? Okay, good.
who is responsible for reimbursement and in what context? So if it's not on the list, we know it's a combination of people.
That's right, and we'll do an investigation. That's where the patient support programs and Jana, these programs are, the people we hire are passionate, they are curious, and they really, really advocate for the patient, so they will leave no stone unturned. Sometimes They're very assertive when it comes to asking the question why. When they pick up the phone to talk to your insurance company, your insurance company may say, if it's a private insurance company, we don't cover your medication, why?
So just for clarification for everyone, if you're in that situation where it's not on the list, it's not on the formulary.
Yes.
This reimbursement and coverage from multiple different things, the PSP program helps the patient with this.
Absolutely.
It is not
Absolutely.
the patient who has to
Nope.
find all these parts and put them together.
No, that is, I mean, we will, if you have an avenue that we haven't explored, of course, we're going to take that, but altogether, we're pretty good at it.
Right. So I ask again, do you think you've been a part of a PSP at some point in your life? Is there more people putting their hands up and being like, oh yeah. And this could also happen behind the scenes without even the patient being aware.
Oh, we try and make it so that the patient is aware enough. So if we need questions answered, or we have to reach out to you, or we need consent forms signed, absolutely want to have a relationship with the patient, but we want to do the heavy lifting. And that is what the patient support programs are there to do, is to do the heavy lifting, to do the investigation, and to let you get on with your treatment.
Okay, thank you. Iris, you are the next one. I don't know if you guys came up here in this order on purpose.
I think we followed the
I'm not
slide.
really sure.
So that worked
Did
out
you?
well,
Okay,
yeah.
so Iris, I'm giving you my next question, and Jana, your question number 3.
Fantastic.
So number 2, the second question here is, what is the role of the drug access navigator and the pharmacist regarding drug reimbursement options?
For sure. So that leads really well from Shanta's answer as well, because the drug access navigator, they are wonderful employees and people who help investigate and coordinate all the funding in regards to the prescribed therapy that your doctor has provided to you. And so the drug access navigator is kind of that bridge between when you get the diagnosis and the prescription and leading into working with the patient support program. And so the drug access navigator is very in tuned and up to date with all the different types of therapies and different programs. And so maybe we might deal particularly with one pharmacy, one program. The drug access navigator has a plethora of information for all the different therapies and treatments and which programs that they would need to reach out to get the patient started there. How the pharmacy kind of comes in is once the medication is prescribed, we have the patient support program has provided information to the pharmacy. On our end, we have the access to the medication, and we have access in terms of how to bill your insurance plan, should it be private, public, or we're getting compassionate medication from the program in themselves. And so the pharmacist is responsible for ensuring that they are counseling you on the new therapy, supporting you through it, understanding how you're feeling with this therapy, the information that you're required, and overall looking at the rest of the medications and the rest of the medical conditions that you may have that may influence how this treatment is going to be as successful as possible. And once we are able to we complete the counseling on that, we will then ship out the medication, whether it be directly to the patient, directly to an infusion clinic, or wherever it needs to be so that the patient can go there and have the medication there. These medications can be quite finicky to handle because they require specific temperatures and or the administration, whether it be injection or infusion. And the last thing we would want the patient to worry about is having to bring such an expensive medication to their appointment. So part of what the pharmacy is doing as well is ensuring that the medication gets there so that the journey of your therapy can be as easy as possible.
So for those in the audience who are going to a clinic to receive treatment, that treatment is coming from a pharmacy to the hospital.
Correct.
And you guys are making sure it's there at the right time, that it's been sent properly.
Correct, yep.
So we may not know that this is what's happening, but it's happening. It's happening behind the scenes. We take for granted that we show up and our medication is there for us and it's given to us, but there's a long journey prior to that.
Definitely.
It did not come from the basement of the hospital.
No. Well, it's maybe sent to the basement of the
Maybe sent
hospital
to
and
the
then come
basement.
upstairs. Yeah, I think most patients are likely more familiar with going to your community pharmacy and being on, oral tablets or capsules and getting it in that manner. When we're dealing with more liquid type formulations that have very strict temperature control in order to maintain the stability so it works the best, that can get really complicated in terms of getting it to the patient and the clinic in itself. And so we want to make sure that there's no compromising in that, and that the therapy getting to you for your appointment is at its best, essentially.
Okay, Jana, you're next.
Okay, can I jump in and
Just-
add something to
yes,
her
add,
question? 'Cause
please, add.
You mentioned earlier, like, we need to have a shout out to like our nurses and our pharmacists. And I think from a pharmacy perspective, we don't always realize what happens behind the scenes. And you will not imagine the amount of times that I get a call on a Friday afternoon, the doctor says, I want to start drug Monday morning. I want that treatment to start Monday morning. And pharmacy is scrambling because to get something to that hospital, you know, in a couple of hours is sometimes almost impossible. And the amount of hoops that our pharmacies jump through to do those, like, we don't see any of that, but like, it warms my heart to know that there are people out there willing to jump through those hoops to make sure that someone can start treatment on a Monday morning.
My doctor, I just did this to everybody. I'm very sorry. So Friday, and I needed to start my treatment this past week. I started Tuesday because Monday was Labor Day.
Yeah.
And the call, the prescription in the call went in Friday afternoon that I was going to clinic
Yeah.
on Tuesday morning.
Lots of hoops got jumped
Yes.
through for you, for sure.
So I'm sorry. Okay, ready?
Yep, I'm
Okay,
ready.
so what kind of support can a PSP, oh, this is a multi.
Okay.
Okay, I'll read them all. And
All
then
right, and I'll ask
Okay,
at the
so
end.
what kind of support can a PSP offer in addition to financial support? Because we've talked a lot about reimbursement and stuff right now. And then can community or private resources close to the patient's home also be included in a PSP's benefits?
Okay, so I'll start with the first one. Most pharma companies in Canada, they're guided by a code of ethics. And in that code of ethics, it talks about, you know, what are the types of things that a pharmacy or a pharmaceutical company, sorry, can do for patients. And so some of the rules are like, we can't replicate what's in the public system already, what's already paid for. We're allowed to provide support for things like reimbursement, for education. But like the big sort of piece of that is if it's already funded, then the pharmaceutical company can't provide support. But a lot of times things aren't, there is no funding for it. For example, one of our new drugs that we just have come out, you've got to stay within close proximity of the hospital for the first week. So in that scenario, if you don't live near the hospital, okay, I've got a flight to pay for, I've got my hotel to pay for, you know, taxis and things like that. That's when a patient support program can provide some additional support. And so that particular program will actually cover your flights and your hotels. It could cover things like sometimes blood work isn't covered, like particular blood tests that you might need for your drug isn't covered by the public plan. And in those scenarios, the PSP can cover that kind of cost as well too. So there's a lot of different things that they can do. I think, you know, when I've talked to a lot of like oncology patients and not just myeloma patients, often it's having that like one person to talk to. And, you know, one of the patients I spoke to recently, she's like, I don't even think that person understands the, like how much they supported me, because I felt totally alone. I went to my doctor's appointments. You know, the doctor talked really fast, said a whole bunch of stuff. I was afraid to ask questions, and I could come back and ask her. And if she couldn't answer me, she'd send me to the right person to ask, whether it was an advocacy group, whether she called the doctor's office themselves, things like that. So I think, you know, it's, you know, interestingly enough, my mom passed away from a blood disease, and I had no idea what a patient support program was at the time. And I wish I'd known, because I think, again, to your point, these people are like huge advocates, like these patient support agents or you know, whatever they're called, they're coordinators. They really want to advocate for patients and make sure that they get the best support possible. There's no cost to you guys, no cost to patients. So it doesn't hurt to reach out and ask, does this drug that I'm taking on, does it have a patient support program, someone that I could leverage?
And all the PSPs, I can speak from the 4 I've been a part of. They're different, right? What they offer is different. The services they offer to patients and their families can vary, can be different. It's very dependent on the medication, the treatment, the journey, those types of things. So I think you had a really great point when you said, if you don't know if you're a part of a PSP, it's good to ask this particular drug that I'm taking or drugs, do they have a PSP program that I could tap into, reach out to, and see if there is services that are available for me. Some may not, because it may not be needed, for example, but it's worth asking. That goes back to being a VIP and advocating.
Totally important to advocate for yourself.
So the other part I think you sort of answered, which is can community or private resources close to the patient's home be included in a program's benefits, knowing that could be different.
And it's different each province, right? Like it's different per province. So the Western provinces, there's less use of private solutions. It's just a different, like how the government is, it's just and how the funding and how things are funded for you. There's less of a need sometimes. But there is always those options as well too. Like sometimes, and it's unfortunate, sometimes drugs don't make it to the formulary, right? So if you have private insurance, you might be able to, go to a private clinic closer to your home, as an example, or if the drug program has a compassionate program. So I think it comes back to being that VIP and making sure you're asking those questions so that you can find out what is available to you.
Okay, Iris, this one is just a one part.
Oh, lucky me, look at that.
At least for now. Okay, so can PSPs, can the patient support program continue after a drug is listed on the formulary and there's reimbursement from the government?
No, we don't really see a lot of that. And maybe from my experience.
Everybody jump in as well.
Yeah, feel free to jump in. It is different. Yeah.
We do that all the time.
All the time, yeah. So in my experience, like at the pharmacy where I'm dispensing, oftentimes when the medication gets onto the formulary, the prescription is then transferred out to the respective cancer pharmacy that is now dispensing that medication. There are oftentimes with some of the therapies, they require adjunctive therapies as well. And it depends whether the drug is on the cancer formulary or let's say like the Alberta non-group or group 66. In that case, if it's Alberta non-group or group 66, which I don't believe I've seen a lot of, but at that point, the PSP can still help navigate in reimbursement and whatnot as well. I think possibly a lot of people here may have heard about going on to Alberta non-group insurances or Alberta Group 66, as it is it's a phenomenal insurance program provided by Alberta Blue Cross to help support patients here where funding could be difficult. Maybe they don't have private insurance anymore or never had drug and coverage insurance anymore too, so for that. And so we don't see a lot of it. Oftentimes, the patients that I've kind of dealt with, once it's gone onto the formulary, the Alberta Health does a great job of having it dispensed through there, but I open it up for your experience.
Absolutely, and I can add, just add a little bit to that. So a lot of what you were talking about in the other services, aside from the actual medication, some of the support services we talk about, that some of these programs do offer. So they may offer one of the things that's being offered in a lot of the newer drugs that have come are maybe mental health support. There could be extra nursing support. There could be non-drug support that the programs offer. And just to be clear, a lot of these programs, they are developed by the manufacturer. So it is the manufacturer. Like Jana said, she does a great job, and she works for a great company in that, she gets to design that, and she gets to say, okay, well, I think patients need this, and I'm gonna, I can champion right down the hallway to talk to those that make the decisions. So a lot of times when they're contracted out to to a Bioscript or an Innomar, the manufacturer's already decided what supports they can afford to add to just, not just the drug, but these ancillary supports that can continue after the medication is on the public formulary. So some of them might continue. But again, these caseworkers that we talked about in the beginning, they're really good at knowing what other supports are available through the system. So, we have specialists in all of the provinces, so they understand In British Columbia, for example, there is a program that does help certain cancer patients pay for transportation. So we're going to, tap into that if possible, help you do the forms that are required for that. And yeah, the medications, and I said it very carefully, I think I said it very carefully at the beginning, Cancer Care Alberta, or Cancer Control Alberta, they changed their name a while ago, they cover drugs that are the direct treatment of cancer. So the ancillary drugs are not covered. So a lot of the anti-nauseants, the steroids that you will still have to go get from your regular pharmacy. One of my past lives was actually working at Blue Cross, so I hope that everybody did receive your package from Blue Cross when you approach the age of 65 to sign up for the seniors drug benefit. If you are under the age of 65, it is a little bit different now because you now, say for example, if your spouse is under the age of 65, they do have to get their own non-group coverage that changed a couple of years ago. So there is always coverage available for formulary medications, but you do have to pay the copay at the, and you have to get those normally from your regular pharmacy. But if it is a financial hardship, sometimes the program will still support that even after the drug itself has been taken into the system.
Jana, did you want to add something about, does the support continue after it?
Yeah, I mean, I think it differs whether it's a hospital-administered drug or if it's a oral medication. So support definitely continues, quite like in pretty much any oral that I've been a part of, there's a lot of support that will continue if the patient needs it, right? So everything is about tailoring to what a patient might want. But I do know of even hospital-administered drugs, and it's not, sadly, it's not my company, I wish it was, that offer transportation. So they'll give, and I can't remember what the dollar amount is, but they give so much a month to cover the transportation back and forth from the hospital. When my mom had cancer, I've got a great job, but I had to pay for parking at the hospital, which drives me crazy. And that's a lot of money, right? It's a huge amount of money. So this other manufacturer, they provide compensation. So you send in your receipts and they'll pay for some of those things, which I think is amazing. And I know I want my company to do more of that. And I think it's something we should also be pushing manufacturers to do and setting up an expectation that we provide support like that.
Pardon my ignorance, everybody, but in terms of going to healthcare in Alberta, I'm assuming it's paid parking. The hospital's parking is free?
Okay.
Like you have to pay for it?
Yeah.
Okay. And it's very expensive. Okay, so Alberta and Ontario are on par for that.
Oh, yeah, it's terrible. Quebec is where you get parking paid, like you don't have to pay as much. I think you get 2 hours or something for free.
Yeah, when I had my upper GI scope on Wednesday, my parking was $60.
Yeah.
Yeah. It's usually between 30 and 60. Yeah, Toronto.
It was like that in Newfoundland when my mom was sick. It was $30 a day. I know. There's so much land there. But I mean, that's a crazy price that we all have to pay. Like, it makes me mad that as a society we have to pay
Especially
those
when you're
things.
going on a regular basis.
Yeah.
Like, it's not I broke my wrist, I'm coming in one
Once.
time.
Yeah.
Okay, sorry, we went off a little bit there. I apologize. Sorry, everybody. I'm learning a lot about Alberta here, which is good because I just recently got Alberta's as part of my responsibility, so I have a lot to absorb. Okay, this next two questions, one question with an example. It's for everyone, so pass the mic, share away.
Yeah.
I mean, you don't all have to answer, but it's open. So how can patients ensure that information gathered by the program will be communicated to the healthcare team? So for example, in the case of side effects.
Yeah, we work really closely. I think we have to really view everybody that is part of your medical team as part of your healthcare circle. And so I know on the pharmacy end of things, when we're receiving prescriptions and enrollment packages and whatnot, we're doing a full review of it. We are getting as much information from whether it be the patient support program itself, the physicians, we're reviewing net care and whatnot like that as well. And we're really quite involving the the patient in that as well and sharing with it. I think one of the things that I love working with Bioscript and especially pharmacy is the access to field case managers, to the nurses, and again, just like any pharmacist within the community, to the physicians themselves, and that's communication. And so one of the things that I wanted to make sure that my clinical pharmacists were doing was sharing all of this information. What is your sick day plan? You know, what has your physician discussed with you about that? If your physician isn't available, you know, let's create a plan for you to have access to us as best as possible, and we'll help you kind of arrange it from there. And then if we need to contact, we have that direct contact to the program, to the nurses, and then to the physicians as well, which is a little bit different from my previous maybe practice in community pharmacy. So on a pharmacist and any of the medical information that we gather for you is yours, and we can provide that package to whichever if you're switching therapies, if we have to kind of do that, that's very easy to do, and I don't ever want to think patients don't have access to that at all, right?
But also too, in terms of communicating, for example, side effects management, if you don't communicate the side effects
then we
that
don't
you're
know.
experiencing, there is nothing for anybody to communicate on your behalf.
Yeah.
So
that's
important
really
that
important.
way.
Yes, that's really important as well.
In the oncology space, whenever you go for, let's say, a medication that could be administered through IV, this is me asking, I apologize for my, do you ever, is there ever any questions asked, surveys, or anything that you need to do, like on a scale of 1 to 10, or have you experienced this, or this, where you say yes or no? Have you ever been asked any questions like that? So often, that's actually questions coming from the manufacturer, I will say, multi-level, and that's also reported. I know the communication goes both ways. It's not just from the PSP to the healthcare professionals, but it's also back the other way as well.
Yeah, and I think and I hope that everybody is asked questions when you go for your infusion, before you get your infusion.
She just proved I was right when I said, if you're not asking questions, you're not doing your job.
Just please ask the questions. And I would, taking from what Iris said here, the PSPs when they began have all of a sudden become, for a lot of, and unfortunately not all medications, but for the medications that we have programs for, they become a hub, and they become a communication hub. And there's different ways to get in, but everything tries to feed to a central point for the patient. And that sometimes is what gets lost in our system. We have NetCare here in Alberta. It's not perfect, but it does contain a fair bit of information. Ontario is a nightmare to try and get electronic health information, and it's in different systems. Different hospitals have different systems in Ontario. So the PSPs inadvertently, and I think almost by accident, are a central point for all of this information to feed into. So again, yes, you must communicate your side effect, but if you're on with a program, it's really good because the side effects are then communicated out to your health team. So, you can mention it to everybody you go and see, but we have that central record, which, to the all data is good data. That's the vital data that we need. So I think that it would be great if there was, and that's where some of the DANs and DACs come in. These drug access navigators that are in all of the centers, they try and be that sort of central point of contact for the patient. But the PSP or the DAN or the DAC, it's a best practice to have a central point like that.
And truly, it's not, oh, well, as a patient of my own journey, speaking as well as, it's not, oh, well, I told this one person, I expected them to tell everybody else. It is a part of your responsibility to ensure that you tell everybody that you can tell what's going on, whether it's a fantastic system where everybody's chatting with each other or not. It is important that we do our job and we tell everybody too. But I think you would all agree that sometimes patient-reported outcomes are not as, we don't always report our outcomes very well, so we need to do a better job. We need to do a better job at reporting outcomes because that information is key. It's used, it's needed.
And I think it's important for your healthcare provider, that team at the hospital, to know, right? And so you've actually kind of stolen my answer, which is kind of has two pieces to it. One of it is Health Canada requires manufacturers to report any adverse events into a big system, but also we're required to report those to the physicians. So PSPs do report that information to the physician, but it gets sent in a file, gets sent in a piece of paper, faxed to the, office. Sometimes there's a call because it's, the coordinator or the agent, PSP agent says, hey, this is really important. But you guys are really the key, right? Like, everyone is human, everyone makes mistakes, it's not a perfect system. So it's extremely important that you advocate for yourselves and tell, exactly to your point, all of the people, so everybody knows, whether it's your pharmacist, whether it's your doctor, all of those healthcare professionals, what's going on.
Okay, the next
Sorry,
one.
if I could just add to that
yes,
too.
Please.
It kind of goes outside, it kind of deals, I guess, with all medical conditions as well. Our hope is to be able to help you before it gets too serious, right? Oftentimes I've ran into situations where the patient was hospitalized, and when they come out, we have a discussion about it, and maybe they just didn't reach out a little early enough that we would have been able to deal with it in the community and help avoid something like hospitalization. And so having the patients really advocate for themselves, ask all the questions don't feel guilty. That's what we're here for. We love it. We love questions. We want
Professionals have said so.
Don't feel guilty at all. Like, it's cliche, but no question is dumb, right? And so we want to be able to see the most success for the patient, and most often than not, it's when they're in the community, they're in their daily lives, they have a high quality of life, and we can help them kind of stay there.
Okay, so Shanta, maybe this question, the next one is good for you. Oh gosh. I mean, if it's not, just throw the mic at someone else. Yeah. So can patients ever find themselves having to pay for a medication like overnight?
Yes and no. So, so yes, you can, because if you think about it, and if we take the specialty medications and the oncology medications out of the picture, if you lose your job and you don't have your insurance ends the day that you lose your job, the next day you don't have insurance. So yeah, that can absolutely happen. Again, the PSPs are designed to have that financial support for the patients so that they can finish their treatment journey. And most of the programs, and almost all of the programs that I've ever worked on, whether it be in oncology or other drugs, they don't start you on the journey without committing to helping you finish the journey in whatever that may look like. So not so much in the oncology space, but in the specialty medication space. So for rheumatoid arthritis or plaque psoriasis.
Autoimmune diseases.
Autoimmune diseases. If a manufacturer starts you on a medication, they are committed to helping you continue on that medication until that medication stops working for you. So if you lose your job in the meantime, we'll investigate other coverages. We'll see if non-group is available. So we might, the program will help you sign up for non-group, and they'll cover you in that 4-month period where non-group has a waiting, has a gap. So they'll cover you in that. So you can technically on paper end up having no coverage. But when it comes to the medications that are supported by the PSPs, very rarely will you be out of pocket. Some of the programs do have limits on the financial assistance that they can provide you. So, and again, this is more Ontario East that you'll have these issues than in the West with the oncology medications. But if you have, Jana said, so oral medications in Ontario are subject to a copay. And they're subject to, a dispensing fee, and they're subject to perhaps if you're on an extremely high cost, they could be subject to a program called Trillium, which is a catastrophic program. So you actually have to be out of pocket a certain amount before the coverage kicks in. So there's pieces there that the manufacturer support program may help you with 80% of that. So could you end up still out of pocket? But that's the whole reimbursement navigation that all of our teams do to ensure that you know that up front and you can make an informed decision. You have all of the information necessary to be able to say, okay, manufacturer, your drug coverage is going to cover this percentage. The manufacturer is going to top it up to this percentage. That leaves you with 10% out of pocket. And that it's going to be, $200 a month. That's then your decision to make.
Is there anybody here who currently resides outside of the province of Alberta, or used to reside outside of the province of Alberta, or think they may one day live outside of the province of Alberta? Anybody? I see a little bit of hands. Okay. So the next question, Jana, maybe I'll send it to you, but again, if anybody wants to, and you guys have sort of talked about it, I'm learning that I'm living in the wrong province.
Some may disagree, but yes.
Does anybody have a basement apartment? My dog does not shed, and my husband is a good husband. No. Okay, so this is actually just about province and territory. So are PSPs available in the same way? So we know that access to certain medications and coverage is quite different depending on where you live because it's very provincial. But the PSPs, so are the PSPs that are available, are they available in the same way in all provinces and territories? Because this is different, it's not government.
No, it's fair. So, I mean, I think most PSPs, the goal is to create equality, right, across Canada so that everyone has access to the same, the same supports. But when I mentioned earlier that we've got this code of ethics, right, where if something is funded, we cannot provide it. So you will see customized based on provinces. So if Alberta pays for a particular drug test and Ontario doesn't, we'll offer that service. Sometimes you'll even see things where things are, and this comes back to the medication, but it's not like as easy as like a drug is on your formulary. It can be on your formulary with a combination of other drugs. It can be on a formulary where it's like what line of therapy and things like that. So it can be quite complex. So you might even have different offerings, even on like what you're willing to cover in something like there's things that we do differently in BC than we do in Quebec, that we do in Ontario. So it can definitely be customized, but the end goal is to make sure that everyone has equal access, right? And I think it's one of our tenets of the Canadian healthcare system is that we are supposed to all have equal access to things. I know it's not the truth, but it is a goal, I think, of Canada as a whole.
This makes me think that the PSP programs have to work a little bit harder, Ontario and East.
Different. There's hard things here. I mean, Alberta is a great healthcare system, but there's a lot of rules. So if your drug isn't on the formulary, getting access is harder, right? It's not impossible, but it's harder. So it's different work that you do here than you would do in Ontario. Or Quebec has got a great program called Patient d'Exception, which means if it's not on our formulary, we have like an exception process. So it's just every province is different, and there's a lot of customization that needs to be put in place.
Okay, so the next step is to move to questions of the audience. Like Sophia and I are going to run around with mics. Well, actually one of us only because we have two. We're going to come around with mics if you have any questions. But before we go to that, I always want to check to make sure, was there anything you wanted to say that you just thought, when you leave an interview and you get in the car, and you're like, shoot, I should have said that. Yeah. So is there anything right now before we get to questions that you thought you might want to add about anything, or a question that was not asked? Anything about PSPs that you think would be important for people to know? Nothing from me. Okay, we'll go to questions. Is there any? Yes, question at the back. Okay. You guys keep that mic. Okay. It's okay, I need to get my steps.
Hi, I just wanted to know, are any of these support programs that you offer, is it also depending on age? Like when you get older, like we know the stem cell transplant programs, once you're 65 or 70, well, you're considered too old. So are any of the medications that go, if they're not covered most of the time, right, has that to do with age?
So yes and no. And it's different across Canada for sure. So under 65 in Ontario, again, you don't want to be under 65 in Ontario.
Oh, thank you. Thank you, Jana.
I know, no problem. It's a completely different process. So there are, in at least from what I have seen, being over 65, you actually get better access to medications and things like that. But services aren't usually limited that I've ever seen by age.
Probably going to say the same. And it does depend very much on what the on-label is for the drug. So that's where it's going to start. So when the manufacturer submits to Health Canada to say, I want this drug to be available in Canada, they go through a negotiation process. So they negotiate what is going to be an on-label indication for that drug. So sometimes that includes age. So because if the drug hasn't been studied in certain populations, Health Canada probably will not give it a label for that, which means that if the doctor wants to prescribe that for you and they still feel that's the best treatment for you, it then becomes off-label. And very few, if any, drugs are on the formularies for off-label indications. So it's a whole other, and the patient support programs are really good at helping to support the physicians in, are there avenues of access? What does that look like? But, what Jana mentioned in terms of the code of ethics is very much as a part of that. So it gets very complex when it comes to off-label indications. And that's where age sometimes can kick in.
I think that's a good point. I know in the cancer space, in the autoimmune space, children, for example, more often than not, clinical trials, medications are not tested in children, like people under the age of 18. So in my world, for example, the highest rate of population being diagnosed with IBD right now is children under the age of 5. That's the highest rate. And their access to medication is very small because of clinical trials not doing any testing on children. So when you ask about age, I think the low and the high, I never think of evidence in the middle, but I think the 65 plus and the under 18 is a very good question.
And just to say, in Alberta, IBD for children, we have a fantastic program.
Well, here we go.
Fantastic program.
Here I am living in Toronto.
Sorry.
Hi, this sounds like an amazing program. I have never heard of it. How do I access this?
Who does she ask?
So you would ask the drug access navigator, who works kind of closely with the physicians. The physicians often know. Actually, in Alberta, there is a phone number, I believe, that you can just call for that as well. And so that's really quite helpful. It's on the Alberta Health Services website as well, if the physician didn't happen to know. But generally within the oncology space, they'll know exactly who the drug access navigator is.
So Mary could go to her next appointment and say to her oncologist or even her her oncologist nurse.
Yes, the nurse.
And just
yeah,
say, can you
absolutely.
please get me in contact with the drug access navigator?
Absolutely, yeah.
And even ask if there's a PSP, like even just ask the question, because not all medications have a patient support program. So just ask the question if they have a PSP and can I access it? If there's any reason that you couldn't, maybe there might not be value, but ask the question.
I can't see past the pillar. Is there any other questions? Yet.
So this is more comment than question. I have to say I've had compassionate access to drugs twice so far, and I had nothing to do with it. My doctor took care of everything. So, I mean, it was just absolutely amazing. And I've had patient support programs because of some of the medications I've been on as well. You got to answer the questions about, handling the drug and going for pregnancy tests, even though I was in my 50s. Yeah, but no. So I just wanted to, I just wanted to comment that we've been very fortunate, I think, with some of the access to stuff, like you said, in Alberta, but our physicians as well. And another comment with patient-reported outcomes, I'm very brutally honest. So, yay, I know yay, but so this is my comment for everybody else in the room. Sometimes people are afraid to be honest because they think then they're going to come off treatment or they're going to get worse or they're going to have to change things. And nothing could be further from the truth. So if you're experiencing adverse events, report it. Yes. And I think Bev's husband said at the hospitals, it should be check your dignity at the door. Something like that, because it is, but it is. So that was my only comment. So thank you for everything you guys do. It's absolutely amazing. And yeah, be VIPs.
Any more questions? Okay, so I hope you all learned something here today. Like I said, I'm on my 4th PSP program because the drug I'm on now is with a different pharmaceutical company than past drugs that I've been on, different pharmaceutical companies, and there is a PSP program offered. I think sometimes as patients and as people involved with patients, we forget or we don't understand really all the levels that the manufacturer and everyone that they contract out, like these ladies here, we really don't understand the work and the dedication that goes behind. And I think society puts a stereotype like as manufacturers and pharmaceutical companies, bad, 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 right? And I always am met with people who have those opinions, who have typically been blessed with fairly good health. Yes. Right? It's not until you meet someone who maybe perhaps has not had the healthiest journey, or who's dealing with something difficult, that the appreciation changes. Because you truly then begin to understand this is the medication that I need. This is the medication helping me. So I really hope you did learn about PSPs. I think all the drug access navigators in Alberta are going to be busy next week. Yeah. Just wondering, is there a PSP for this medication? So, sorry. I started off by apologizing. I'm ending by apologizing. It's going real well. So yes, any more questions before we break? No. Thank you so much. I know you can sometimes be worried this is going to be a firing squad because you come here from where you're coming, your backgrounds, but thank you very much for being here. Thank you for everything that you do. Thank you for caring about us. Thank you for being an equalizer. All of those things. Thank you very much.
Thank you very much.
Thank you very much.